you. I'm Dr. Libia Scheller. I'm the medical director at the Institute of Medical Education and Research. And we are reporting from you live from the 2010 American Society of Clinical Oncology here in Chicago. And we are so pleased to have Dr. Marshall Posner, who's the medical director of the Head and Neck Cancer Program at the Tisch Cancer Institute at the Mount Sinai Cancer Medical Center. Can you please comment on what, if you had to choose the top 3 areas that need answering in the area of head and neck, and where there is currently phase 3 trials and important trials that are addressing these, what would you say they would be?
Well, I think the major question will be post-operative adjuvant therapy, and I think there are several trials out there. There was some very interesting data with labatinib showing an improvement in local regional control and survival. It was intriguing. It was a small randomized phase 2. There's a large phase 3 trial with labatinib that's going on looking at this, and I think that will be an important question. I think one of the other questions is, can we give adjuvant cetuximab for a prolonged period of time, or zalifrelimab for patients, and will that improve survival in patients receiving chemoradiotherapy? It's very hard to give chemotherapy after chemoradiotherapy, and I think these post-operative and post-definitive therapy trials are going to give us some very interesting data. I think right now the studies that are really under development that we really like the answer to most is, can we reduce radiation therapy for patients with HPV-positive cancer? And I think, unfortunately, there are no active phase 3 trials. There is a phase 2 trial by ECOG asking a question of whether we can very significantly reduce radiation for these patients. I'm not sure that this trial will answer that question, and I know it won't answer it definitively because it's a phase 2 trial, but I think that will be important as well. And I think there's going to be a lot of work on biomarkers. There's a lot of data now on what goes along with HPV that defines the small part of HPV-positive disease in which we have clearly poor outcomes. And these are people who have smoking, so there's a behavioral component, but there's also clearly a biologic component. Identifying that in tissue will be very important. Those will be prospective evaluations.
So in general, we really have more questions than we do answers for head and neck cancer, and it looks like there's a lot of clinical trials ongoing right now. We have a lot to look forward to when it comes to those outcomes, and we so appreciate you being here today and sharing with all of our viewers as to what's going on, not only here at ASCO, but also in preparation for us as to what to see in the near future. So thank you so much for being here.